Good afternoon, everyone. This is Evelyn Mantilla from Access Health, Connecticut. I hope that with our sound check that you can hear us well, and we are ready to start today's webinar. First of all, let me run you through a couple of housekeeping items. Should let you know that participants are automatically muted once they are logged in. Please keep your audio muted for the duration of the webinar. We will hold questions that will be reserved for the end of the webinar. I encourage you to type into your chat box any questions that you may have during the webinar, and at the end of the presentation, we will be able to address those questions. And lastly, if you find your audio component experiencing any technical difficulties, or you wish to call in instead, switch from audio to phone call in the control panel. It will give you a phone number and access code to dial in and listen to the webinar. So with that said, I want to let you know we are recording today's webinar because it will be made available to everyone after we are done, to all of our community partners. And so today's webinar is titled The Status of Mental Health in Connecticut. As I mentioned to you, my name is Evelyn Mantilla, and I work for a firm called Grossman Hines. We serve Access Health Connecticut. And our distinguished presenter today is Luis Perez, LCSW President and CEO of Mental Health Connecticut. I am going to move along to the next slide. And first of all, introduce Luis. Luis, welcome.
Well, thank you very much for having me.
Terrific. No, it's a real honor to have you here to help us impart this information. And before we even start the presentation itself, tell us a little bit about Mental Health Connecticut.
Well, gladly. Mental Health Connecticut is actually celebrating its 110th anniversary. We were founded by Clifford Beers, who most people know as the founder of the Child Guidance Clinic movement in the United States. But at the turn of the century, Clifford found himself as a Yale graduate from a prominent Greenwich family working in Wall Street, and found himself at Connecticut Valley Hospital. Later, he was also treated at what is now known as the Institute of Living, back then the Retreat, and he was diagnosed with what we know today as bipolar disorder. And needless to say, he found that the treatment and the stigma associated with his condition became a barrier to his continuing to fulfill his life and continue to seek treatment and recovery and acceptance among his peer group. So he founded the Connecticut Society for Mental Hygiene, and a year later founded the National Society for Mental Hygiene, which has evolved into Mental Health America. Mental Health Connecticut has gone through also several evolutions. And most recently, we have really focused on, rather than mental illness, focusing on mental health and wellness. And through a strategic planning process of our board, we changed our mission to improve the mental health of Connecticut residents at large. So we are engaged in 3 activities. We do advocacy. We want to make sure that the rights of all Connecticut residents are preserved. We do community education. We want to make sure that through knowledge and information, we battle the stigma and discrimination against persons with either a behavioral health, whether it's mental health or a substance use condition. And we also provide services in the western side of the state. We focus on 4 areas, and I will be touching upon some of that during the presentation, because we truly believe that social determinants, not just the symptoms, need to be addressed. We need to address the person as a whole. We need to make sure that people have housing that is affordable, safe, and sustainable. We want to make sure that people have access to health, whole health, not just behavioral health, substance use, mental health, primary care, dental, all of those things are part of the domains that we address. We want to make sure that people have purpose, that people have the ability to be employed, to go to school, to volunteer in their communities. And we also believe that community is very important. Family members, friends. Often people in the throes of their beginning of their mental health condition will self-medicate and unfortunately use illicit drugs, which then compounds the problem with legal issues. It breaks apart the connections, the natural supports that they have in their community. And it is so important for a person's well-being and certainly mental health to have those natural supports. We all benefit from having those supports around us when we face stressors in our lives, whether it's employment, family, etc.
Mm-hmm. Terrific. Okay, thank you. Thank you. I'm particularly excited to have this conversation with you because as you describe the mission of Mental Health Connecticut, it's obvious that it lines up very well with the mission of Access Health Connecticut. And it's no surprise that in the mission statement for Access Health Connecticut, health disparities is a prominent issue. And looking at and improving and addressing the social determinants of health are also very much part of how Access Health Connecticut is looking at the issues that affect our consumers. And so we're not just here to provide health insurance and to reduce the rate of the uninsured. We are here because we also want a healthier Connecticut, and a healthier Connecticut is all around, including mental health. So terrific. Thank you so much. I will hand over the presentation to you. I'll be happy to move the slides for you. Thank you. So let's go ahead.
Sure. So let me start by laying groundwork around why we collect this data. In Mental Health America, we're an affiliate of Mental Health America. And by being an affiliate, we have the rights to this information. And so I do need to give them credit for the work that they do. But it is important. Why is it important to collect data across all 50 states and the District of Columbia? It's important because we need to inform our policymakers. We need to inform our leaders in each of the states and around program planning, analyzing what the effects of both the social determinants, but also the predominant mental health conditions in terms of being able to have an orchestrated approach to population health. And also for terms of evaluation. How are we doing? Are we meeting the goals and objectives that we have set out to be? So understanding the changes also have to be reflective of legislation, and you know that better than most in policy. And also we need to increase the dialogue and improve the outcomes for those that we're both serving and advocating for. So key facts and findings. On a yearly basis, as I mentioned, MHA does the study. We will have some comparison data later on. But what we know is that 1 in 5 adults have a mental health condition. And out of those, 18% of all adults have a mental health condition within the subset. In terms of youth mental health, we see that it is worsening. The rates of youth with severe depression increased from 5.9 in 2012 to 8.2 in 2015. So that's a significant increase. And 76% of those were left with no service or insufficient treatment. So access clearly continues to be an issue across the country. And out of that, we know that 1.57 million of youth had, with a major depressive episode, did not receive treatment at all. And we can only make educated guesses, if you will, as to why is that. Of course, with youth, there's a reliance on parents being aware of their child's changes in terms of both behavioral as well as mood, and for them to take action. Sometimes kids will mask those feelings that they're having, or those changes and that they're feeling internally, because they may not want to talk about it. They may not want to worry their parents about it. They don't want to feel different. And we know that feeling different is a normal condition for adolescents. And when then you compound it with something that is so stigmatizing, you're going to see even more resistance from that. The increases can also be attributed on the positive side in that we're doing more screening. And we have, while not sufficient, I'm not suggesting that, while we have still shortfalls in terms of access to care, we have improved our ability to identify and have people have access both from a service provider, but as well as on the websites that people can access for in a more anonymous way, if you will, in terms of screening. So more Americans have access to services, as I just mentioned. Access to insurance and treatment has increased. The Affordable Care Act did an amazing job in terms of expanding access to healthcare and has reduced the rates of uninsured adults. The rates of uninsured adults with a mental health condition have decreased by 5%, which is, again, when we're talking about 40 million Americans, that's a significant yes. reduction. But the greatest decrease in uninsured adults with mental health illnesses has been in states that expanded Medicaid. So we have seen that trend consistently since the ACA passed. The other fact and findings is that, and no great surprise, in states with the lowest workforce, there's only one mental health professional per 1,260 individuals. Imagine those kinds of wait lists when you're talking about accessing assistance. And that includes all behavioral health professionals, psychiatrists, psychologists, social workers, counselors, and psychiatric nurses. And to provide mental health care, providers in the lowest ranked states would have to treat 6 times as many people than providers in the highest ranking states. So there were 7 key measurements that MHA utilized for their study. They were any mental health illness, or AMI, dependence or abuse of illicit drugs or alcohol, serious thoughts of suicide, AMI who did not receive treatment, AMI reporting unmet needs, AMI who are uninsured, and disability who could not see a doctor due to the costs. So overall rankings. As you can see, from 2017 to 2018, the overall ranking for using those 7 points, Connecticut unfortunately dropped. Connecticut was ranked number 1 for its adult healthcare system, or mental health care system, to number 10 in the country. Some of the reasons, I think, have been, while we have made great strides in terms of providing more insurance and therefore access to individuals, the fiscal barriers that the state has faced in the last few years has meant that there has been reductions in the safety net. We see in Connecticut access to services can be through either private insurance or public assistance. And what we have seen through the Department of Mental Health and Addiction Services, we see that their network of services, both in the state-operated local mental health authorities as well as the private nonprofits, have seen reduction in funding and therefore reduction in the workforce, which, back to the earlier slide, where while we're not at that point of 1,260, we're certainly decreasing the number of professionals per individuals in our communities. So when it comes to youth, using, again, 7 key measurements, at least one major depressive episode, or MDE, in the past year, dependence or abuse of illicit drugs or alcohol, severe MDE, MDE who did not receive mental health services, severe MDE who received some consistent treatment, private insurance that did not cover mental or emotional problems, and identified with an emotional disturbance for an individualized educational program or school. Again, we have seen a decrease from being ranked number 3 in the country down to number 5. Similar issues, I think that we have higher use of social media and internet. Certainly has a significant impact, particularly around adolescents and young adults. Cyberbullying is certainly something that has compounded the issue, and again, access to the services that they need on a timely basis. The other piece that greatly has affected us is the fact that not only the mental health and behavioral health system has experienced cuts in financing, but also school systems have had to cut back in school psychologists, school social workers, and again, the identification and early intervention has impacted all of those factors. So when we talk about ranking the prevalence of mental health conditions, it's important to understand what the prevalence is and in which areas and in which diagnostic criteria is being impacted. So again, the 6 key factors for measurement in the study were for adults with AMI or any mental illness, adults with dependence or use of illicit drugs or alcohol, adults with serious thoughts of suicide, youth with at least 1 MDE in the past year, youth with dependence or abuse of illicit drugs or alcohol, and youth with severe MDE. So this is interesting. We found that in 2017, Connecticut had the lowest prevalence of these mental health conditions. And yet, 1 year later, we're seeing that we have gone to number 18 in terms of prevalence of mental health conditions. Again, this could be attributed both to the social determinants that we have talked about. We know that there has been a higher rate of unemployment in Connecticut than in other states. The economic growth and recovery has been slower. So those are all things that have impacted. And I also think on the flip side, not everything is bad news. I think the ability to be able to have more outreach and people being more open about screening and talking about their mental health or substance use has also improved. So the access to care rankings. This is important because we know that the earlier the intervention, the better outcomes we are going to have. And so access to care, whether it's access to insurance, access to treatment, access to quality services, maintaining cost of insurance at a lower level, access to special education, and again, workforce availability all have impacts in terms of our care rankings. And it the study showed that most Americans lack access to care, and 56% of American adults with a mental illness did not receive any treatment, and 7.7% of youth had no access to mental health services through their private insurance. And that certainly has a huge policy implication. Connecticut was the first state to have parity laws. Parity is very basically if you have certain benefits in your physical health insurance, those benefits need to be the same for behavioral health services. And we have focused a lot on the quantitative. In other words, if you have the limits on hospitalization, for example, cannot be any different from one side to the other. But we need to do a better job of looking at the qualitative aspects of care and coverage. And certainly for children, again, that is a major concern. And 1 in 5 Americans report an unmet need in terms of their willingness and wanting to access care. So the access to care rankings, if we can move to, yeah. So in 2017, Connecticut ranked number 4. And we have not slipped too badly there. We have gone down to number 5. Certainly, when you take a look at the states that are ahead of us, lower population, much more better penetration in Massachusetts. So, when you look at Vermont, Minnesota, and Maine, you're looking at different population, different social determinants. But I think that the fact that we have improved access through both access to insurance, while we have experienced a decrease in providers that can provide that, that combination, I think, mitigated the drop from one to the other. So let's talk a little bit about overall rankings, right? So we have looked at the 15 measures that were included. I won't repeat them all. They're there on your screens. But I think that there's a couple that I think are important to highlight. Again, we've talked about children with private insurance that did not cover mental or emotional problems. We have talked about students identified with emotional disturbance for an individual education program. Again, access to those services have been diminished in the past few years, but certainly most importantly in the last year. And then we know that suicide trends in the United States and in Connecticut have also been increasing. Certainly, the co-occurrence of both a mental health condition and alcohol or illicit drug dependence is going to compound the issue, both in terms of earlier symptoms arising, as well as having a more difficult time in terms of being able to coordinate services and be able to address once access to care has been determined or care has been accessed in terms of the efficacy of those treatments. We know, and for many years, Connecticut has, again, been a leader in terms of promulgating the IDDT or oh my, integrated dual diagnosis treatment.
Thank you. It comes to you, not to worry.
So IDDT has been, the best practice, if not evidence-based practice, that we have again enforced and reinforced with our providers. So I think that again, we have a much better outcomes here than in other places. So overall ranking, Connecticut ended up as number 5. I think that in 2011, we moved up to in 2014 to number 1. We're now back down to number 5. So the trend, while we can say, gee, we're in the top 5, by comparison with other states, we are definitely good enough, should not be good enough when it comes to health and access to health services. So some data that are more drilling down a little bit more in terms of the adult rankings and what and some analysis of the data. So we dropped from number 6 in adult prevalence of AMI to number 11. So now we're seeing ourselves, when you start narrowing down, we start slipping further down in the rankings. Dropped from number 29 in adults with dependence of substance abuse or alcohol to number 46. So again, we are seeing increases, and certainly the opioid epidemic has contributed to these numbers. Dropped from number 1 in adults with serious thoughts of suicide to number 2. So again, we're seeing an increase in suicide rates, or at least serious thoughts of suicides. Dropped from number 8 in adult access to care to number 17. That's double-digit drop. So that's of concern and something that we certainly need to start paying attention to as we look at our fiscal policy affecting our public policy and health policies. We dropped from number 23 with AMI reporting unmet needs to number 33. I think we talked a little bit about the unmet needs and the contributors to that, and certainly area for much more conversation and discourse. We dropped from number 5 in adults with AMI who are uninsured to number 10. So we have seen a slight increase, only about 1,000, and we can only assume that, again, the financial constraints of both the private industry in providing private insurance, as well as the access for those, increases also in terms of individuals who may be uninsured or uninsurable. Because of legal status, et cetera, may be a contributor to this. We have seen a lot of an increase in undocumented individuals in the state. So that may be one of the factors impacting this. And then we dropped from number 8 in adults with disability who could not see a doctor due to cost. So again, we went from number 8 to number 15 there. In terms of the youth rankings, we dropped from number 6 in youth prevalence of mental illness to number 18, threefold there. Dropped from number 8 in youth with dependence or abuse of illicit drugs or alcohol to number 37. Dropped from 13 in youth with severe MDE to number 23. So significant increase there as well. Increased from number 4 in youth access to care to number 1. And then dropped from number 23 in youth with severe MDE who received some consistent treatment to number 24, 4,000 youth versus 5,000 youth in 2018. We remained at number 2 in children with private insurance that did not cover mental or emotional problems, so we have not made much headway there from one year to the other, and remained at number 12 in students identified with emotional disturbance for an individualized education program. So we're holding there, but not seeing increases. And I can tell you that anecdotally, my wife is a elementary school principal in an urban setting here in the state of Connecticut, and we're seeing a higher increase of need and less supports and resources to address those. So mental health workforce availability, and again, this is not only the ability to be insured or be able to access services when you're uninsured, is our major factor, and all the social determinants that go along with the population and individuals. But the workforce availability is also being impacted. We're seeing higher or lower levels of individuals going into the health and human services and the helping professions. Part of that, and most significantly, when we look at minority, gender, when we look at racial and language, we're seeing again across the board decreases in individuals, and I think that the rate of pay for and rate of reimbursement are both something that are having a huge effect in the ability to recruit and retain individuals in the health and human services arena. I've heard some disturbing numbers in terms of turnover. Anywhere from 40 to 60% of the workforce turns over in our private nonprofit segment of the workforce. So something that is very concerning. The governor's cabinet on health and human services has been addressing this. In fact, on Friday there's a conference being sponsored by Mental Health Connecticut and OPM in collaboration with other providers. And one of the things that is being highlighted is the need for a true collaboration and partnership between the school, the state universities and community colleges, and strengthening, again, and the ability for people to access education is going to be one of the points of discussion during that conference on Friday. So Connecticut remains steady.
The land of
The
steady
land
habits.
of steady habits. We're still at number 10, although there is a slight increase in terms of the number of individuals per provider. So what does this all mean, and what can we do about it, right? So certainly we can be advocates. We have a responsibility, not just as mental health providers and mental health professionals, to advocate for better healthcare, quality healthcare. But I think that as individuals and as citizens, we need to understand that nobody is immune to having a mental health condition through their lifetime. And it is important to improve mental health literacy among our population and the residents of Connecticut for a variety of reasons. We know that stigma and, again, discrimination will prohibit or be a barrier for individuals to be able to access services. We know that if you have a good system of care, you need to have a good ability to access services for early intervention. You need to have prevention programs. You need to be able to access services, and you need to have hope and be able to think that you are going to recover from your condition. And when we talk about the big conditions, schizophrenia, bipolar disorder, major depressive, that's that's a small portion of the population. I think we need to understand that whether there's stressors in family, stressors at work, those are going to lead to some level of distress in your way, in your functioning. So I think that this next
we have a video that we want to show you.
We'll speak to that.
Terrific. If you hold on for me to pull up the video, we'll share this with you.
Our brains control how we act in the world. But did you know the world around us also affects our brains? Our genes, environment, and social interactions all work together to shape the way our brains develop. Sometimes these factors combine in ways that create unhealthy thoughts or feelings. Over time, these unhealthy thoughts and feelings become so unmanageable that we need outside support to get better. 50% of people will develop at least one mental health condition during their lifetime, and half of those people will develop a mental health condition by age 14. Unfortunately, it takes about 10 years for people to get the treatment they need. We don't wait to treat health problems like heart disease or cancer until stage 4. We shouldn't wait to take care of our mental health. The right early treatment can change lives, reducing school dropout rates, hospitalization, incarceration, and unemployment. Imagine what the world would look like if we all got the help we needed when we first started showing the early warning signs. Start the conversation before stage 4. Visit mentalhealthamerica.net to get informed, take an online screening, and better understand your own mental health.
Terrific. Thank you.
You're welcome.
Tell us a little bit more.
Sure. So, yeah.
Mhm.
So, as I mentioned earlier,
Sorry about that.
that's okay.
My apologies. Technical difficulties.
No worries. So the unintended outcomes of policy is something that is very dear and close to the work that we do at mental health today. We understand that while we have reduced the number of inpatient beds in the state, we know that we have increased the number of people incarcerated that are not receiving mental health treatment or appropriate levels of mental health treatment in our jails and prisons. We have shifted that the institution from one department to another. We also know that we have in some ways institutionalized people in the community because of, again, barriers to being able to seek employment, being able to access education, being able to participate in their community to the full extent. So what we see is that as those, whether it's oppression, financial constraints, we're going to be seeing an increase in the stages or in mental health conditions. And it's important to understand when we talk about stage 4 and the analogy that, we would not wait for cancer to have reached stage 4, or we hope not to. Often with a mental health condition, that's what occurs. But we need to understand what those stages are from the mental health perspective. So at stage 1, again, a person may exhibit mild symptoms and warning signs, as the video highlighted. That usually occurs by, if not earlier, certainly by age 14. And in stage 1, a person begins to show symptoms of mental health condition, but it's still able to maintain the ability to function at home, at work, or at school. And perhaps, they are just not feeling right. They know that there's something wrong, but they just don't know exactly what it is. In stage 2, symptoms increase in frequency and severity. and interfere with life activities and roles. That's when you start seeing parent-child conflict. You start seeing conflicts and increases perhaps in marital relationships, other significant relationships. You may start seeing some discontrol, not quite domestic violence, but you may start seeing, again, physical or verbal altercations, being and not keeping up with your role, whether it's in your family, at work, or socially. Then in stage 3, symptoms worsen with relapsing and recurring episodes accompanied by serious disruption in life activities and roles. So it's stage 2, but on steroids, if you will.
Yes.
Symptoms have continued to increase in severity, and many symptoms are often taking place at the same time, co-occurring with another symptom, and it is significantly impacting the person's role, whether at home, school, or at work. And then in stage 4, symptoms are persistent, they're severe, and they have jeopardized one's life. There's loss of employment, loss of relationship, loss of housing, all of those determinants that we know are going to compound and impact the ability of an individual to achieve recovery.
Terrific. Well, that is the end of your presentation, but we're not done just yet. I will give you a little bit of a break while I am able to share with our participants some information directly from Access Health Connecticut. And that is that we want to let everyone know that Access Health Connecticut and its outreach efforts works very hard at establishing partner opportunities across the state so that we can amplify our voice and bring the information that we need to the consumers everywhere in the state of Connecticut. I have a couple of resources I want to share with you, and that is one of my favorite, first of all, is the community website. And I talk about it everywhere I go because if you go to learn.accesshealthct.com/community, that is the website where you will first of all be able to see recordings of all of our webinars, but you will also be able to see announcements of the events that we're participating in, as well as actual material that Access Health Connecticut designs for educating our consumers, and they're made available to everyone for downloading and printing right there. We do have in-person help as we get ready for open enrollment, which, by the way, is coming right up, starting on November 1st and ending on December 15th. You can go to support.accesshealthconnecticut.com to see where, if you have someone that you serve, one of your clients who needs to be able to apply through Access Health Connecticut, you can find out where they can get in-person help everywhere in the state of Connecticut. We have community, really we call it a newsletter, but at this point we have conversations and we issue information by people, for folks who sign up for our emails, and of course the educational webinars like this one. I want to highlight for you ways in which you can contact us directly. Most of the folks who are participating in today's webinar are our community clients. There are folks from many groups, many different organizations. And if you want to reach us directly to the outreach team, the best things to do is to email us at outreach@accesshealthct.com. That will get information directly to the outreach group, the team. And you can also, of course, go to the website that I mentioned already, learn.accesshealthct.com/community. Through that website, by the way, you can sign up for our emails, but you can also contact us and send us information and suggestions of, for example, community events that you feel that Access Health Connecticut should participate in. We're always looking for ideas like that. And very importantly, this year, we are getting ready and preparing for the 2018 community conference. If you haven't RSVP'd yet, if you haven't signed up, please save this date, Friday, October 19th. It will be held at the Red Lion Hotel in Cromwell. It's very centrally located for everyone. And you can see a link on this slide for where you can sign up to attend the community conference. It's available at no cost, and it's really a wonderful opportunity to bring all of our partners together and discuss the issues of the day and get ready for open enrollment and be sure that we are going to serve all of our clients, all of our consumers, the best way possible. So for anyone who is on today's webinar, if you work with a group, if you would like to become a community partner, give us a call at this number. It reaches directly to the outreach team, 860-327-5517. The email I mentioned to you, outreach@accesshealthct.com. And of course, don't forget to check out the website, the community website. We are very heavily invested in social media as well as one of the ways in which we reach people in our state. So don't forget to follow us on social media as well. And so with that, that's the end of my little presentation, but I want to bring it back to you. We encourage people to input any, to type in any questions that they may have in the chat group, in the chat box. And I have one already. Let me read this for you, and we can have you answer it for us. It looks like I work for a community clinic, and we do have a lot of people who need to be seen for mental health. However, the waiting list to see a psychiatrist is too long. And from what we noticed, pretty much everyone is on the same page. Do you have information, suggestions on which we can refer our patient clients to so they can get the services that they need? And this seems to address one of the points that you made very clear in terms of the availability of professionals in the field.
Absolutely. One of the things that we need to do is think about what the appropriate level of access needs to be. Not everybody needs to see a psychiatrist right off the bat. And while other states have looked at their Medicaid state plans and have allowed other mental health professionals to be the certifiers of services for Medicaid, Connecticut has not taken that step. Mm-hmm. So a psychiatrist is the only entity in the state that can, or professional that can certify treatment and approve a treatment plan. So that is a stumbling block in Connecticut when it comes to the Medicaid system. Certainly that's different in the private insurance sector, and depending on what your plan allows, you may be able to access other services. But the issue of psychiatry, psychiatrists as medical professionals are the lowest paid. So again, there's a financial barrier to people going into the profession. The constraints of it's not just financial, the constraints and the ability and to get authorization for services can often be very frustrating for psychiatrists because of their need and want to help. So those are all factors in terms of, and then when we start looking at minority populations, monolingual populations, you start seeing even less of a workforce to address that. There are some things out there that have been helpful. Loan forgiveness, for example, in terms of student loans and assistance. both from the federal government and in some instances, the state government have helped in terms of increasing or attracting individuals to a particular area. But primarily those are targeted toward urban areas, and we know that our rural areas in Connecticut experience even more of a lack of professionals to serve. So the other thing that passed the legislature last year is telehealth. So we will be seeing regulations. Now it's a matter of writing regulations so that the regs will guide the practice, and we will be seeing that more in the state of Connecticut since it's allowable by law.
And what is telehealth?
Telehealth is you go online and you have a professional on the other side. You use Skype or whatever technology is available. It's a secure connection, and you are able to speak to a professional in a remote setting. Got it.
Terrific. Very good. So, it sounds to me like we are aware of the difficulties being able to have sufficient providers, and clearly this speaks to the policy need for taking steps to increase the number of providers that can be recruited and trained and be part of the overall solution. That makes sense. Another participant is asking if they can have a copy of the PowerPoint. The answer to that I can give you is yes. We're more than happy to share the PowerPoint. Also, this full webinar will be made available because it's being recorded. Guess where? In that community website that I just talked about.
And people can also access all of this information and more, both at www.mhconn.org, that's Mental Health Connecticut's website, or at mentalhealthamerica.org as well.
Terrific. So that website again is mhconn.org, correct? Beautiful. Terrific.
Well, we're talking about, there's a couple of other interesting studies that have just come out. There's the USC Schaefer report on the cost of mental illness for Connecticut. I would encourage people to access that as well. And that's University of Southern California, the Leonard D. Schaefer Center for Health Policy and Economics. And the other one is I thought I had it here. I will send you the information for the Millman report, which is a report that grades all of the states in terms of their progress towards full parity.
Mm-hmm. Great, thank you. Some of the participants that signed up for today's webinar were also able to send us some questions that they may have had ahead of time. And before I address one or two more questions, let me point everyone to the chat box where my colleague, you will see it appear as Grossman Hines, and posted a link to a very short, I promise you it's short, Survey Monkey. I would love to encourage every participant to take a moment and click on that link and give us your impression of today's webinar. Access Health Connecticut is constantly looking at improving the information that we provide to our partners and the public in general. And so getting your feedback is really important to us. So take a moment and click on that link and make sure that you fill out that survey for us. Okay, I have another question for you. This one is coming from one of the participants. Are there efforts being made to increase the need for bilingual, bicultural mental health providers? What statistics are there available?
I will get back to you in terms of the statistics. I don't have those handy.
Mm-hmm.
But
sure.
I can tell you that as I mentioned earlier, there are several initiatives in terms of attracting individuals. The problem is that you identify the problem, right? We have a lack of individuals, and unless we are able to attract people that are already trained you then see, you're going to see a curve of about, 5 to 6 years before you can see an increase of individuals or professionals, because they have to go through schooling and training and being recruited to the Health and Human Services and professional processes. So there's always a lag time between the time you identify the gap to the actual increase in addressing the need. So this is one where, frankly, if I could come up with an answer for this, I could retire.
I'm sure, yes.
Because as I mentioned, earlier, what we're seeing is actually a decrease, not an increase, in individuals, young people going into the Health and Human Services professions. So I think that we need to do a much better job at the both middle school and high schools in terms of sparking interest and enthusiasm for people. And we definitely need to do something about the economics and the pay rates for not only Health and Human Services, but also education professionals.
Great, thank you. I'll have one more question before it will be time to close the webinar. I have another participant saying, what about changing, hang on a second, as healthcare professionals and mental health professionals, how can we be proactive by getting in front of this issue? What preventive measures or steps can programs implement? Sounds like a big question.
It's a very big question. So let me start by saying that most of us professionals have a trade organization or a representation. Whether it's the National Association for Social Workers, the American Psychiatric Association, nursing, et cetera, and I think that we need to push those organizations to advocate. And at the policy level with legislators and to inform. We often make the assumption that legislators have all the information and are content area experts in everything. And that's not the case. That would be unrealistic, right? So we need to be really good at getting the message, informing them, educating them so that they can make the right policy decisions. So until we take responsibility for that part of it, we could not, point the finger and blame. And I think that, coalitions are great because it often ends up that, one professional group, is fighting against the other. And unfortunately, sometimes that sends mixed messages. And that can, that's what having been the legislator, in the legislature. So I think that coalitions and as much as we can trying to get consistent messaging is very, very important. And again, as individuals, we are not just professionals, but we're citizens, and we should hold our elected officials responsible for what we want Connecticut and our public policy to be. And again, unfortunately, we have been driving public policy through fiscal policy, not the other way around.
It's an important civic responsibility. I couldn't agree more. And I did say that I would have one more question, but I am going to slip in the very last one because I think this is very interesting. Tell us a little bit about where we are in terms of reciprocity regulations with other locations, and the participant specifically talks about regulations that are preventing the influx of providers from other states and regions, such as Puerto Rico.
Right. So a couple of things. One is that Connecticut does have one of the highest standards in terms of licensing, certification in the states. So the issue is that how can we facilitate people being able to meet the standards? I don't think that lowering the standards is the answer, but coming up with programs where back to the areas of need that we talked about earlier, how can we have programs that will support and facilitate the person or that professional to be able to meet the standards of Connecticut is where we need to, again, from a policy perspective, be able to do that.
Terrific. Okay. Well, thank you. Thank you so much for your participation.
You're
First
welcome.
of all, Luis, we really appreciate you taking the time to help us to come to Access Health Connecticut and help us impart this important information to the participants that were with us today. I really want to thank you for taking the time to be part of this important conversation. Let me point you to the chat box one more time and urge you to please be sure to fill out our little survey to give us feedback about today's presentation. It absolutely helps us make a better product, provide better information as we offer these programs such as these webinars. And so with that, thank you to everyone. Thank you for your time, your commitment. Thank you for everything that you do for the residents of Connecticut and those most in need. So with that, we'll close the webinar and say goodbye. Thank you.
Have a good day.